You're listening to the Ethos Podcast.
Hi, and welcome to this podcast with myself, Nick Broughton, and I'm joined today by Paul Sims, founder of Impatient Health, who is going to be one of the people presenting at our symposium, our June symposium entitled Pharmaceutical Marketing, Are We Brave Enough to Change? 11th of June, be there or be square. Paul, nice to meet you. Perhaps, for our you're on the commercial side and the marketing side of the pharma life, if you like. For our compliance and governance people, who are a lot of our audience, tell us a little bit about yourself and what you do at Impatient Health.
Sure. Well, I guess the clue's in the name with Impatient Health. I've spent over 20 years in our industry now, and have spent much of it being a little frustrated, if I'm honest, Nick. The reason I do what I do is because I believe we're not fulfilling our potential in our industry, quite simply. We are an industry of very clever, very smart people who I consider to be somewhat tunnel visioned. Not through anyone's fault. It's simply the nature of the intensity of the role, the need to stay within the lines, the need to do what we need to do. But I think we're missing the bigger picture. I think that if you argued that we are where patients need us to be today, I think you would find that very difficult. We are a long, long way away from where we could be in terms of providing real healthcare for real people. And I see my job really as one of trying to bridge that gap to speed up evolution, if you like, and get us to where we need to be.
To provoke a change and a reaction to some extent.
Yeah.
I mean, I feel that I have, which is why we, approached you to speak at our symposium in June, but I have a similar feeling, but probably from a different side, from the medical and compliance side. I've spent a long time in medical affairs. What's if you had to sort of pick on one or two things within how we market medicines at the moment, what would you say are the bits that really frustrate you?
Can I only choose two? That's going to be tricky. The truth is that this type of provocation is absolutely necessary, just as it is an evolution. We call it mutation, of course, there, and we see what sticks. But unless you have those mutations, you'll never change. So I see my role as being one to experiment, to try to push people's imaginations. One of the areas that I think that we get wrong right now is that we consider it our job, whether we're marketers or even as compliance and regulatory professionals, to educate and inform. Now, that sounds very worthy. It sounds like the right thing to do. It sounds, in many ways, why we came into the business to do it. But firstly, I don't think that we are really pushing the impact as strongly as we should. We are often safety first, and we're not actually using the tools and the skills at our disposal to actually have the necessary impact. But perhaps more importantly, information and education is very easy to obtain elsewhere. And our job as an industry, I think, is to push to a higher level. I think that we should be trying to inspire, trying to provoke, as we just mentioned, and trying to really introduce what might be possible. And sometimes that means talking, of course, beyond the product, which, of course, is a field that we could spend an entire podcast just talking on with that. But I do find that we are incredibly myopic at the moment in our communications and our ambition with those communications. So one thing I'd like to see is really just to aim for something more.
Yeah. So, I reflect, having been in the industry a long time, like yourself, that in truth, the approach to marketing and promotion of medicines hasn't really changed, certainly whilst I've been in the industry for decades, and probably quite a long time before that. It's the same model of tell-sell. Is that too far? I mean, what do you agree with that? I mean, we sometimes hear about omni-channel and we're using different routes to approach people, but to me, it's the same approach through different.
And that's the great delusion that we're in. There's a new trend, the new shiny object every few years. Of course, right now it's all about AI. But as we all know that the the tools and the techniques are never going to be the answer alone.
Yeah.
We all know that they are enablers. They are enablers of both good and bad. I saw a great post yesterday, sort of 2x2 grid, and along the horizontal axis, it was all about, I think it was about judgment. So on the left, you have does not have good adjustment, and on the right, it does have good judgment. And of course, people on the left of that are essentially dead weight to your company, and people on the right are probably a safe pair of hands. Then you add AI to the mix, and people without good judgment that add AI just end up being those people that create slop, is the phrase that we're using now. Just reams and reams of low quality stuff, and actually that loses trust, that loses quality, and it overemphasizes the vanity metrics like volume and activity and all of those things that medical affairs have unfortunately indexed themselves on for far too long. But on the right-hand side, where you've got good judgment, you suddenly became, a turbo brain, as it were, someone that is capable and competent. And so depending on who the tool is in the hands of will then depend on whether or not that tool indeed is a negative or a positive influence.
Yeah.
And it's the same with everything that has gone before, every technical evolution. You can imagine omnichannel being done very badly, as it often is, and you can imagine it being done very well. So it's not really a one-size-fits-all. And absolutely, I agree with you. Very little fundamentally has changed. I actually think that in our industry, we barely know what a good strategy looks like. We say that our aim is to be number one in a certain disease category, for example. That is not a strategy. That is just a vague hope.
Yeah.
And it's so common that we don't actually look at the fundamentals behind what we're doing and be willing to move those chess pieces in a more brave way, I would say, and actually change the very nature of what's possible.
Yeah. And I worry that we're going down with AI. We're just repeating the same mistakes of previously, that we went through it a bit, I feel, with social media, when social media was a thing. It's not hardly a new thing now, but everybody sits on their hands and says, well, what can we do to the regulators? Well, work it out for yourself, but that involves working out what's right and wrong and defending what you're doing, and that's a bit more complex than we were used to previously for that. I think we may be going through the same sort of cycle with AI, where people will start saying, well, what can we do? And asking the PMCPA and things like that for opinions about how they market things, which is, crazy. But it needs people to be able to make judgment and good calls. But the investment in that side of use of AI is poor. I mean, the companies are pouring hundreds of millions into AI, but they're not equipping individuals then with the skills to make good judgments.
Indeed.
And that's a problem, I think.
I mean, there was a paper that came out by MIT last year saying that, I can't remember the exact number, I think 85% of AI initiatives end up being a waste of time and money. I actually don't think that's a terrible thing, because to a degree, some experimentation is obviously necessary. It's something new. We are going to have to find out what actually works, and the best way of finding out is to try things. But I think underlying what you've just said there is this sense that we have to stay in this sort of vanilla zone and we can't try anything new. I often think about sports people. If you were a great sports, or you wanted to call yourself a great sports person, you would likely need to know the rules of your sport. Yes. You can't be a good footballer without knowing where the edges of the pitch are. Right? Yeah. And you don't see that as a negative thing. You might remonstrate with the odd referee, of course, but you don't see that you see it as a natural constraint of the game that you're playing. Why is it that pharma marketers and those in medical don't see that understanding the rules and regulations as a superpower? Because how can you be creative? How can you call yourself a great marketer without knowing these things? And
true creativity, in my view, has boundaries. You've got to know what the boundaries are. I mean, we can all make up ideas that are crazy, but they've got to be realistic and within boundaries. And creativity is within boundaries, and knowing where those boundaries are. So I so strongly agree with you. I appreciate on the medical and signatory side when the people that I'm working with on the commercial side really get what my problems are and what I've got to think about, and they and they, I think, appreciate it when I'm thinking about what is in the commercial interest. But to some extent, this dichotomy is terribly destructive, isn't it? Don't you think?
Yeah,
I
mean, the usual advice, of course, is engage the signatory early, engage
Yeah.
MLR in the MLR process, whatever you call it, as early as possible. Make sure people are on the same side. And that is... some people in your position, actually, I find dispute that, because you don't want to limit creativity at the beginning. So you've got to be careful with that. But of course, trying to get on the same page early and see yourself as part of one team as opposed to fighting against each other, that to me makes a lot of sense. But you're going to find those meetings, those early meetings, far more productive if it isn't adversarial from the off, because, of course, you both have an appreciation of what other is trying to do.
Yes.
I'd like to see maybe a couple of role swaps take place, maybe just for a few hours or a day, or some kind of workshop where people just get a shorthand experience of what it's actually like to sit on the other side as a simple means of appreciation, if nothing else.
Yeah.
But obviously learning an immersion into that world. Nobody wants to fall foul of the law. Nobody wants to do something unethical. Nobody wants to create something which is going to cause a patient problem later down the line. But you absolutely need to know where those boundaries are if you have any ambition to do something that is more than just moving the deck chairs on the Titanic.
Yeah.
You have to know what the foundational elements of what you're trying to do are if you have any hope to change anything. And I really do believe at a fundamental level, I find that when I give, talks and things, people come up to me and say, "Oh, you've reminded me of why I joined the industry. You've brought me back almost to this childlike glee of why I joined." And I really believe that's deep down within us, even if we've been working in our industry for 30, 40, 50 years. That is there, that fundamental desire to actually create health at the end of the day.
Yeah,
I think that is there.
I so agree that we can do a lot more, generally, I think. And this is part of how we promote and such, but to remind the people that work in industry, and particularly the people on the coalface, the sales representatives actually meeting healthcare professionals, that they are helping people they will never meet, because that's a powerful motivator. I always remember once I did a talk at a sales conference when I worked within a large pharma company. And it was a comment made by one of the sound men at the end of the day as they were clearing up, who'd been listening all day to the talks. And he came to me and he said, "You were the only person who mentioned patients all day."
Wow.
Now, he had nothing to do really with the industry. But we've got to get back to motivating people about helping other people. Yes, we've got to make money, but there's powerful motivation there that we miss out.
My little trick, of course, is to, as you know, I like to provoke, not just for the sake of it, but for the reasons we said earlier. And I like to almost be a slightly insulting to the way in which things are done. I call it scientific servitude, as if you are only reactive, you are only some kind of servant to the HCP.
Yeah.
And that is the sort of bottom level of the Maslow's hierarchy of being in medical affairs or in regulatory. And the health creator is at the very top. But of course, like with Maslow's hierarchy, you've got to have the bottom layer, the safety and security layer, before you can achieve the top.
Yeah.
So it's not one or the other. Just recognize that the work you're doing right now is only the foundation of the house that you plan to build. Mm-hmm. The house itself could be any manner of shapes and sizes still when you've built the foundation. So just recognize and have a clearer vision, have a bit more of a carrot rather than just a stick beating yourself, that, there is a very proactive, a very forward-thinking, and a very inspiring future that you yourself can bring to the world of healthcare.
Yeah.
And I would regard that as being the minimum standard I would expect from people in our industry.
Yes. Yeah. Let me take you back to what you were saying at the beginning about the fact that we seem to feel our job in pharma and marketing is to educate doctors. And I talked a bit about tell, sell. Mm. What instead do you think we should be aiming for? Are we talking about something that's more about discussion and interaction? And where does what we've just mentioned, the patient, fit in this? Because compliance is often used as a reason we don't speak to patients. Of course, it's nonsense, but people often use that excuse. Where's the direction forward, I suppose?
So the reason I say education and information are perhaps a prehistoric focus area for our industry is because we live in the world of information overload. It is not exactly hard to obtain learning and education materials from many sources. And even to think that the pharmaceutical industry should be a primary source of that information, I think is a little deluded. The idea that your own website is somehow going to become a popular place for an HCP to be is just, in my opinion, absolutely ludicrous. We have to be where they are, and we have to show them what could be. I find that we all know the answer to this question. We just have to remove ourselves from our professional sphere and think about our personal sphere. Sometimes when I give talks, I say to people, right, we're at 1.0 now. I can give you the 2.0 talk, which is going to be the safe and predictable. It's still going to be future focused, but it's going to be a bit more incremental. Or we can whack it up to 11, and I can give you the slightly unsafe, strap on your seatbelt. We don't actually know if it's going to arrive anywhere interesting, but it's certainly going to take us on a journey. And without fail, everybody, even the most stoic and safety conscious people, will put their hand up for the 11 option. So given that choice, why should our customers actually be any different from that? Why not talk about what could be in the future? There is no reason why we can't talk, for example, about how a new emerging young generation might interact with this disease that we're focusing on right now, in their communications, in their attitudes, in the way in which they approach their healthy life. That is a very rich vein, super interesting, of course, because of all of the things that are changing in the world, and might bring you to a superior quality of relationship, of discovery with your customer, within a sort of conversation of that nature that starts on those kind of terms. Ironically, it's exactly the sort of conversation you would probably have if you ended up in a casual or unexpected lunch with your customer, as opposed to the formal setting of his or her office.
Yeah.
So why not aim for something that builds a better relationship, uses the art of storytelling, something else that we have somehow lost in our industry, but we all know is the absolute way in which information resonates with us, as has done since the dawn of time. But the reason why I say provocation is because, quite simply, people don't usually know what they want. People are very bad at being able to see beyond the short term in understanding what is going to be useful for them. And it kind of puts into question the entire practice of traditional market research activity, surveying, understanding what our customers say and do. Because the truth is that if you have any form of novelty about whatever medicine it is that you want to bring to the world, the customer, even the patient, is going to be unlikely to suggest what is ahead of them, or even have a conversation with you about that in the short term. What we have to do, and we have to see as part of our job, is to propose what could be. And by doing that, you've all heard the Henry Ford quote, if I asked customers what they want, they would have said a faster horse.
Yeah.
They couldn't imagine a car at that time. It simply didn't exist. But really, it's not confined to the world of automotive engineering. It's actually anything that has ever been brought to the world that is of any real note has been brought by some kind of inventor or entrepreneur, or, and of course, the medicine itself can be very novel in so many cases. And it's this kind of provocation that then creates a greater reaction, a more raw reaction, a more real reaction. And that's where you can actually learn. So it's not that we're closing our ears and we're deaf to what our customer says. I'm not advocating that. What I am advocating is that we take the time first. We're the ones that can afford to invest, to think, to really come up with what a provocation or an inspiration might look like, then go to our customers and then listen to the reaction, listen to the objection. It may be wrong. In fact, it probably will be if you've really tried hard to provoke. And that will teach you what it is that you need to go next. And it's just the ordering of things that I think that we need to look at changing. So if we have that inner ambition and the courage, of course, to promote something that is possible, then I think that we will have a much richer conversation, a much more learning-based conversation, and it will actually make the HCP want to go and learn in their own time about some of the specifics.
Yeah.
Now, of course, I realize we might be treading on some, there are probably some people listening to this that are wincing as we talk about where that ethical boundary lies, about where that compliance boundary lies. But that, again, is where that superpower exists. If you know the rules, you know how to get up to them, but not cross them. We don't want you to cross that boundary. We want you to know where they are so that you can have that type of a conversation.
Yeah, I mean, couple of things I'll just reflect on what you've said there. Firstly, websites. I know it's a minor thing, but I've sound off hundreds of websites probably in my career, and I can't think of any that I would go to myself. And if I'm looking for information about medicines,
and your clients are listening right now,
yeah, well, yeah, but I'm being asked, is it compliant? Well, it's compliant,
Sure.
but would I go and see it? Well, no. And if I've got a medical issue or my family's got a medical, do I go to a pharmaceutical company website to find the answer? No, I go to other sources. Now, that to me is a bit of an indictment on a lot of the websites we put together. And so I think we can produce websites with interesting information, but a different approach is required. Next thing that caught my ear, if you like, as you spoke there, is this issue of the customer. Because I have a particular, I'll never change it. We will always call healthcare professionals customer.
Yeah.
But to me, the patient is the customer. We're just in a very odd market where we can't talk to our customer. But ultimately, if you think of the patient as the customer and think of yourself alongside the healthcare professional, what's in the customer interest, then you will be tending, if you're really thinking about the patient, you'll be tending to be ethical and compliant. You will also be thinking about the same things as the healthcare professional next to you, rather than with the patient somewhere in the background of any discussion. So I think there's a mind shift, a mental model shift there, if you like. I suppose the other thing around the rules, again, which is close to my heart, is where I slightly disagree with you, is that where you know where to push in anything. Because we don't know where the lines are when you're doing something truly novel. You have to make a judgment and be prepared to defend it and make precedent and put a good argument together. And sometimes I think that idea that there is definitely a right and definitely a wrong and a line between the two is a nonsense we've got to get rid of. And particularly, in some of the people entering marketing, have got to get that out of their heads and start to think how they justify their actions and make precedent. And yes, you might get complaints, you may have to defend them, but you're not doing it with a red face. You're making a good, strong argument. My final question to you, though, is because I think, I'm singing from the same hymn sheet as you on many things, though we're coming from different perspectives, is that I think farmers often quite conservative about this and tend to have similar approaches to what we're talking about, because it's a big risk to do something different. And this has brought the profits in previously, the current approach. How do you know, my challenge to you, how do I know that I'm going to make more money doing what you're saying than what I'm doing now? Because then I might listen to what you're saying and take the risk.
I want to ask you, first of all, whether making more money is the thing that's keeping you up in the morning and the thing that you're going to be proud of at the end of your career, for a start. And, whether it's evolving the standard of care that might be more motivating to you. I would suggest perhaps that if you're in this industry, I would hope that is at least a segment of your motivation, at the very least. Now, the approach I'm advocating is of course, higher risk, higher reward. I'm an entrepreneur. I started my own company, as have you. We are naturally predisposed to being more tolerant of risk than the average person. So it might be very easy for us to come here and say, yes, we should all be more courageous. We should all be more ambitious. The truth is, it could go wrong. And if you have a comfortable family life and children in expensive schools and a quality of, you may not be willing to risk that. I would suggest that in any industry, you're probably familiar with the adoption curve.
Yeah.
You tend to have laggards on the right-hand side and innovators and early adopters on the left.
Yeah.
The average is around 2.5% of people being in the innovator camp and about another 10 to 13% in the early adopter camp in any industry. So those are the group that are slightly more courageous, shall we say. They're the ones that are willing to try something without necessarily knowing if anyone has tried it before.
Yeah.
And the famous lines in our industry, of course, are, bring me innovation, but also show me who's done it before. Right? So quantifying it, there are probably around 15% of people that fit into this category. And that, like you said earlier, is unlikely to change. But I think it's a process of identifying and actually enabling that 15%. I tend to, in a really crude way, you could describe the 15% as disruptors, and everyone else should be defenders, as opposed to people who pull the plug away from them. You might not be that risk taker yourself, but I really, really want that significant portion of you, 85% of you, who may not consider themselves to be audacious or risk-taking, to consider themselves to be defenders of the risk-takers, as opposed to people who just say no because it's the easy and comfortable answer. You need to allow others to have a little bit of oxygen in the room. Often, we've optimized ourselves to be on the peak of one mountain, and we suddenly realize we want to be on the peak of a different mountain. But to get from one mountain to the other, even when you're as tall as me, Nick, you can't just step from one to the other. You actually have to go downwards, backwards, against the grain, if you like, into the valley before you climb up the new mountain. It can look and it can feel obtuse. It can feel absurd going backwards against the convention. And you're not going to be the one to make that journey, but somebody in your organization almost mathematically will be. Just enable that person. And it may well be that they will get you to a better place.
Yeah.
Of course, there will be failures. We hear about the successes far too often, and we hear about the failures far too little. And it may well be indoctrinating us into thinking that any risk or any bold behavior is somehow going to win, which is obviously untrue. But we also know that overnight successes are rarely so. They take many, many years to come. And it's the ability, of course, to be flexible and agile, another buzzword we use every day, that is going to enable us to make more attempts, to have more experiments. Again, come back to evolution. We human beings only exist through a process of blind evolution. This is what one of my favorite quotes from somebody called Leslie Orgel is, evolution is cleverer than we are. In other words, the blind process of just repeated mutation and experimentation has somehow got us to a better place than an architect or even a godlike figure. I don't want to bring religion into this, but even a godlike figure could have designed for us, right? So it's taken millions of years, yes, but we got there. And as I said earlier, if you don't experiment, you'll never change. So just be willing, I would say, to try. Otherwise, we will get to the end of our careers and actually have a lot of regrets.
Yeah. Well, I think that's a great place to bring this to a close. But thanks so much for your thoughts, Paul.
Most welcome.
And I hope we have more conversations in the future. And looking forward to your talk at our symposium in June.
I don't doubt it. And thank you for being brave enough to invite me.
No worries. Thanks.